our health services are an embarrassment. Our mental health services within that are a humiliation. And that's not to criticise those that are at the front line, but it is to recognise the systemic failures that have happened too often and are too prevalent. In this chamber and in this debate, we hear all the right things from government representatives. It has ever been so. But on delivery, the proof is in the experiences of children and adults. For many, the experiences are positive once they enter the system. But for far too many, the experiences are marred by delays in entering the system or being denied access to that system. And then, of course, for others, the experiences of the system itself has actually been a bad one. The reports from Kerry CAMHS are absolutely scandalous. But they're not new. This specific instance might be new, but the story is all too familiar. There's a failure in our health service. It's brought to the attention of HSE management. Nothing is done other than actually the ostracisation of those who actually brought it to the attention of the management. Eventually, the reports are made public, and then that's followed very quickly by an apology and the rhetoric of, we have learned the lesson. But no one in the HSE management is held to account. That's the most predictable trajectory of any of these scandals. Those that failed to monitor the care that children were being provided, those who failed to heed the warnings, they're either moved sideways or they're left in place. Same salary, pension still secure. And unless and until individuals within management are held to account for their failures, nothing will change. 3 government leaders came together and they agreed, without any process, rationale or justification, a pay rise for a Secretary-General of the Department of Health of over €81,000 per annum. If the same leaders decided that the government will prioritise mental health services, as Mark Ward's motion tonight calls on them to do, and if the same leaders are determined that there will be accountability within the HSE, then it will absolutely happen. But nothing in the government remarks tonight suggests that they're up for delivering that necessary change. Minister, we are.